The process turns from growing bone to growing fat. And probably what happens is if you were to crack open somebody's hip and look, the 10-year-old's hip is going to be full of bone marrow, right? It's going to be full of cells that want to make blood cells, hematopoietic bone marrow. If you look at an older person's hip, it's going to be full of fat. So we're essentially sucking fat and blood out. But it turns out that the fat that's in your hip bone doesn't have a lot of capillaries, right? And we want the capillaries to get the stem cells. So this is probably not what we really want. The bone marrow aspirate, this BMAC term stands for bone marrow aspirate concentrate. That's what BMAC means. And basically Arthrex is out there and other companies promoting to the world that we can get growth factors out of the hip rather than true stem cells. So if a patient comes in or a doctor says to the Arthrex folks, hey, I've heard that there aren't any stem cells in the bone marrow aspirate, or I've heard that this isn't good for my 60-year-old patients because they don't have any stem cells left. They're like, well, this is not really a stem cell treatment. It's more of a growth factor treatment. And no one knows what that means. There's no placebo-controlled randomized trials to prove efficacy, and you can't expand the cells because they must be minimally manipulated. I'm going to go back to that just a second. Let's say you pull out an aspirate of somebody's hip and you get 5 stem cells. Well, if we had 5 stem cells and we could isolate them and we could put them in culture and we could incubate them, those 5 cells could grow into a couple million cells, which would be then a good treatment. But the FDA says that that is minimally manipulating the cells. And so nobody's really doing that. So the best you can do is get a bunch of blood and a bunch of fat and 5 stem cells out of the hip and inject it back into somebody. So we're sort of out on the whole bone marrow aspirate, even though it's all over the place. Platelet-rich plasma, this was largely populated in early 2009. This is the thing that Kobe went to Germany for, right? The thing that Kobe got injected in Germany was essentially PRP in a microwave. That's what they did. They got the blood out of him, they put it in a microwave, extracted the platelets and injected into him. Tiger Woods got some PRP, lots of hype. Steph Curry got PRP for an MCL strain last year, right before the playoffs. So all of the high-level guys that you've ever heard of have gotten PRP injections. Lots of hype around PRP. There's minimal data. The nice thing about platelet-rich plasma is compared to what I just told you, liposuction, grinding a trocar into your hip, it's easy. It's a blood draw. Essentially, put a little needle and draw blood. It's easy to prepare. You essentially have a special centrifuge and a filter. There's some stuff in the bottom of the tube that basically collects the red blood cells, and so you can sort of fractionate the blood into all of the different products fairly easily. And then patients are used to joint injections for osteoarthritis, right? We have cortisone shots, we have HA shots, hyaluronic acid shots. And so people are used to injecting something into their knee for osteoarthritis. However, there's still a ton of public confusion. There's a ton of propaganda about platelet-rich plasma. The thing that sort of changed my mind on this is that there's some decent level 1 and level 2 data for efficacy now. Most of it, to be honest, is preclinical data, means rats and rabbits, right, not people. And it's been proven for chronic tendon problems especially. Chronic tennis elbow, Achilles tendonitis, patellar tendonitis. Anything that's been going on for 6 months or more, this actually works pretty well. This is one study, and again, I promised you guys that I wouldn't put a lot of studies up because I know that's super boring. But this is the thing that changed my practice for PRP injections. So this was published in 2010. In May. And I read this study in May, and I started doing PRP injections in May. This is a double-blind randomized controlled study, which is level 1 evidence, right? The best study you can do. There was 51 patients in the PRP group and 49 patients in the steroid group. This is for chronic lateral epicondylitis, so chronic tennis elbow. We're not really great at treating that anyway. And so they had a nice double-blind setup. 49% of the steroid group, the cortisone group, was successful, while 73% of the PRP group was successful. So that's pretty good. But the difference is the steroid group improved initially, and then it all came back, right? It went back to a chronic problem. So what did that do? It took inflammation away for a couple months like cortisone shots do, and then it went back to the normal problem. The PRP group, it took 6 to 8 weeks for it to work, but then they continued to improve over time. So that's 73% of them. Took 6 to 8 weeks, 73% of them were better, but they were cured for the length of the study. So that is some pretty solid evidence, and I started doing it just on lateral epicondylitis patients because of this study. I didn't do it for anything else. And that was in 2010, so that was 9 years ago. There's been a lot of data since then, and I'm just going to show one more study. If you take PRP and you inject it into a joint in a mouse, you can make a mouse have arthritis by putting collagenase in their knee. It'll melt the cartilage away, essentially. So now you have an arthritic mouse. You can make the mouse like a human by putting them in a box and making them stand up for their entire life, right? So this is mouse torture. So these poor mice were jammed in this box where their front legs had to be up on this wedge, and they equally loaded their hind legs. And we're talking about all of your rehab stuff and, pronation of the foot when you're doing single leg balance. These poor mice had to live in a box for the duration of their life. Collagenase-induced arthritis in both hind legs. One leg got 3 PRP injections into the knee. The other leg got 1 PRP injection into the knee. So they did 1 versus 3. They killed the mice after torturing them in a box and then looked at the cartilage regrowth. So the cartilage stains purple. The subchondral bone also stains purple. So this is the femur of a mouse. This is the tibia of a mouse. This is the growth plate here. The joint spaces are here and where this red box is. When they look at the histology in the red box, if you look at the 3 injection leg, this is on a single mouse here. If you look at the 3 injection leg, you got all this cartilage to grow back, right? If you look at the other leg, single platelet injection, only that much cartilage grew back. So that changed my practice too. That was a study where, because I was only doing a single injection for intra-articular problems for cartilage regrowth. And so I changed from doing 1 injection to doing 3 injections because of this mouse study. Now, that was only 3 years ago. So between 2010 and 3 years ago, if I was injecting PRP for arthritis, I was doing it one shot at a time. Now I'm doing 3 shots 1 week apart, based on that mouse study. So that's it. That's the stuff you can get from yourself. And I can answer any questions at the end of the talk. But the second part of it is what can we get that's donated from other folks? So this is amniotic membrane. And you guys are going to hear a lot about this from your patients because it's going nuts these days. It was originally described for wound management. And the idea is that you can take a piece of placenta that is going to be discarded anyway. So this is a non-invasive harvest of some really good tissue that has potential for healing. So it doesn't require a trocar in your hip. It doesn't require a liposuction. Moms are going to throw that stuff away anyway, so we can use it. Most of the clinical data was for diabetic foot ulcers. This is a growth factor-based treatment. As we looked at on our previous slide, no stem cells. So what they're doing is they're using that membrane to induce wound healing. So the amniotic membrane is a thick tissue. It has a fibroblast layer here. It has a lot of collagen here. It has an epithelion here. And the idea on this slide was that there was a combination of growth factors and stem cells that would induce healing, rapid wound healing and regeneration. Turns out that works. And there's a lot of data in the podiatry universe that shows if you have people with chronic diabetic foot ulcers and you lay a big chunk of placenta on that wound, it'll heal. Sounds gross, but looks like it works. Turns out that lately they figured out no stem cells, right? So the reason it works is not because of a stem cell activation as much as it is a growth factor initiation. So there's no clinical trials that show any effectiveness for osteoarthritis. There's early data for micronizing this and injecting it in for plantar fasciitis. But really, most of this has been wound care. It has been the go-to option for podiatrists, and we've used it in my practice in a limited fashion for chronic surgical wounds that got infected or opened up or didn't heal very well, and it works pretty well. So you get it in a little, sort of square, and you basically sew it on or paste it onto the wound. Those placental-derived tissues have a lot of the factors that we talked about with stem cells, like anti-scarring properties, anti-inflammatory properties. But the problem is that if you talk about amniotic stem cells, which we'll talk about in a second, they're different than adult stem cells. They do not demonstrate decreasing proliferative potential with age, which means that if you get stem cells out of the placenta, these cells are unique in that if you age them out years and years, they'll still proliferate like crazy, right? They like to grow. And that makes some sense, right? These stem cells exist to grow a baby, so they're probably better than the old ones that you might have left hanging around in your fat. And they'll differentiate into bone, muscle, cartilage, ligament, and tendon in vitro. So back to this slide, umbilical cord blood, no stem cells, fat, lots of stem cells, dermis, ton of stem cells, right? Because there's a ton of capillaries. So my most recent look at the data has been that the guys that are out there giving you placental tissues and amnion and sort of promoting these growth factor treatments have missed the boat. Because if you look at the studies, almost all the stem cells are in the umbilical cord. And what's interesting is that the vessels, the vein and the two arteries that go through the umbilical cord have no stem cells, which makes sense because it's a combination of maternal blood that's going into the baby through the umbilical cord. But the cells around it are incredibly rich in stem cells. They're undifferentiated cells, and we've proven in vitro, so in the lab, that they can be influenced by the environment to form cartilage, which is awesome, right? So slapping a piece of placenta inside the knee, not going to work. Suck out some of this Wharton's jelly, it's probably going to make new cartilage. So this is the newest thing that's out there now. It's the simplest of human connective tissue, which means that it's just jelly. There's no fibrous, there's no ligament, there's no capsule, there's no scar. This is just stem cell jelly around two veins and an artery. And that's it. And it's easy to suck that out and use those cells. It's also a homogeneous cell line, right? So all the stem cells look like one another. They're all these pluripotential cells. But the techniques to extract this stuff from the umbilical cord are a little bit difficult because there's higher concentrations right around the blood vessels. Because as we talked about before, these are perivascular cells, right? So you want to be able to get the really high concentration that's down here right off the blood vessel. And the farther away you get from the blood vessel, the lower concentration of cells that you have. So there's a company that figured this out. This is a company called Predictive Biotech that's out of Utah. These guys are promoting all types of stem cell treatments. So they'll sell you some placenta. They'll sell you a centrifuge to get PRP. They'll sell you whatever you want to inject into somebody. But most recently, they got approval for this Wharton's jelly stuff, and we have been using that Wharton's jelly from them